Let's go in 5, 4, 3, 2, 1. Hello, everybody. It's Brian MacArthur from Design My Medicare, and this is our annual free annual enrollment period video that we send out every year. It's a great opportunity to reconnect with all of you, give you some updates on what to expect this open enrollment season. I miss the boring open enrollment years because now nothing's boring. Things are just changing all the time. And part of that's exciting and part of that is taxing. But along with those new responsibilities, with the fact that the business grows, as any Medicare insurance agency does, and the open enrollment window remains 7 weeks every year, we have made great efforts to make sure that everybody's taken care of in that short 7 week window. So what I'd like to do first is introduce you to our team at Design My Medicare. So like I said, there's just been more to do, so we need more people to do it. So I'm going to start off and just introduce you to Hanzel Soronio and Alex Lopez. Hanzel is our operations manager. She has been part of the team for well over a year and is the glue that holds us all together. And I'm just kind of giddy and excited to just start introducing Alex and Hanzel and future team members to you. So I'll start with that. So Hanzel, I don't know if you'd like to maybe introduce yourself.
Hi everyone, this is Hanzel Sorono.
Excellent. And yeah, I'm sorry, go ahead.
I'm there.
No, you're doing great. So excellent. Well, Hanzel is very likely when you call the office number, it's Hansel's pleasant demeanor and friendly voice who picks up. But that's a small portion of what she does. She's juggling many a chainsaw behind closed doors to keep the operations running and help with scheduling and organizing data in a way that we can be prepared to make the most of our meetings. So so happy to have you here, Hanzel, and thank you.
Thank
Um,
you.
Excellent. And then next is Alex Lopez. So Alex is our Director of Client Experience. Um, and he's just been a terrific addition. So grateful to have him on the team. And he has been spending a lot of time with a good portion of you, and many more of you will get some exposure to Alex. And I will go as far to say that a meeting with Alex, whether it's the gentle introduction to Medicare or reviewing your current plan, um, I I think we communicate identically down to the syllable. So I'm going to go as far to say the meeting with Alex is just as good, maybe even better than a meeting with me. But anyway, Alex, I'd love for you to introduce yourself to everyone.
Salutations, folks, and thanks, Brian. My name is Alexander Lopez. I am the Director of Client Relations, which is a very fancy way of saying I'm here to help every single one of you out. Um, the one of the beautiful things about being able to work with Brian and the team is that we are independent insurance agents, which means that everything comes down to finding and optimizing the best plan for you. I've got a technical background, I've got a sales background. I know how to pick and choose between different plans. We're not beholden to any one thing. So we do a lot of conversations. I guide you along, but you lead the way. And I'm always very excited to talk with you folks. I hope that we'll have more meetings coming up very soon, but it's always interesting and everyone's always a little different. So it's important that you and I go through the details and really just try to find what works best for everyone.
Excellent. No, you do a great job of that. And it's been a total game changer to be able to have two great professionals like you to I mean, this is starting to feel like a real company, right? We were joking about that yesterday. So anyway, I'm excited for everyone to get to know both of you. I will move on and encourage you, if you are on Facebook, to like the Brian MacArthur at Design My Medicare page. Let me see if I can make this any bigger. We'll put a link, but I'm starting to communicate with you more because just the market environment requires it, and I want to. But anyway, Brian MacArthur at designmymedicare.com. If you can like that, it's a good opportunity to catch updates as they come in. So I would encourage you to do that. Also, Hanzel is terrific about sending you Google review links. Many of you have left Google review links. It really does matter in this crazy digital age. So we are so appreciative of those of you who have left a 5-star Google review with some context of what you like so much. And, it's weird if you mention the word Medicare or Brian or Alex or Hanzel, that stuff matters. So thank you for that. And we'll leave a link that even if you've done a Google review, maybe you could do a Facebook review, right? So anyway, thank you for that. So as we move into this open enrollment season, let me start with the themes that are similar. Number one, in general, no news is good news. If you're not hearing from us, we don't see a reason to make any big changes on your plan from our perspective. Now, we never want to rob you of an opportunity to ask questions or check in on something. However, if you're not hearing from us, we don't see a reason to make any changes. Okay. That doesn't mean that you can't book a meeting and, go through some concerns or, or anything like that. But it is a busy time of year. We have a limited amount of spaces. We've got more spaces now with Alex and Jen, who you guys may know from previous years, will probably be helping us out as well. But I just want to let you know, no news is good news. Okay. That being said, we will probably be reaching out to more people this year proactively to schedule an annual review than we have in previous years. There's a couple different reasons for that. You're not in trouble. Nobody's going to the principal's office, but there's just different dynamics of how long you've been on Medicare, or you're on Medicare Supplement or Medicare Advantage, that warrant a deeper dive into seeing if we're still on the right plan. Number two, the Inflation Reduction Act is going to be very disruptive to most people on Medicare. Disruptive is not always negative. It will certainly help certain people. It will be disruptive and create price increases to others. You may not like the news in certain cases, but we still have to know the news, right? So we'll be chatting with you about that. And ultimately, some of the time you've been on Medicare, some of the disruptions are going to create opportunities to see if we can just reprice and keep you priced with or below the market. We just don't want to have you exposed to any bigger pricing disparities. So this year's theme from front to back is inflation, inflation, inflation. Okay. So whether it's trying to reduce inflation, or trying to understand the Inflation Reduction Act, or trying to combat the Inflation Reduction Act if you are on the losing side of that legislation, or delivering good news if you're a beneficiary of the Inflation Reduction Act. So there's a lot more to learn this year than in most years. You don't have to memorize it all, but we're going to be reaching out to you on the things that we already know are relevant. Okay. So that's the overarching theme is inflation, 6 ways from Sunday, good, bad, and different. A lot of things we have to talk about this year. Before we get into it, one of the things I wanted to do is lay out and maybe kind of a refresher on the difference between Medicare Supplement and Medicare Advantage. And the good news is there is no bad news. Okay. Whenever you're on Medicare, especially going from, employer coverage before to Medicare now, Medicare Supplement, Medicare Advantage, whichever you choose is almost certainly going to be the best health insurance you have ever had, period. Some of the things that have changed, a lot of you are predisposed to PPO style coverage. Okay. That's not to villainize HMO, but a lot of you come by way of most of you came by way of your full service financial advisors. And if you allow us to generalize, a lot of you are good savers and you're kind of predisposed to having the flexibility to choose have the doctors you like, but have the autonomy to go wherever you want. This Medicare Advantage versus Medicare Supplement thing has really evolved, I think, for the better over the last few years. If you were an early client of mine, you may or may not remember, it was a bit polarizing. Both sides were good news, but Medicare Advantage plans had no monthly premium and were magnificent HMOs, and Medicare supplement plans were the only things that felt like a PPO. They don't say PPO on it, but it feels like a PPO. And they had and have a monthly premium. And there really wasn't much in the middle. You could pay zero, have a magnificent HMO, or you had to pay the monthly premium for the Medicare supplement that felt like a PPO. For a lot of you, not all of you, but for a lot of you, you won't care how good an HMO is because you're not an HMO person. So those are shorter conversations, and we had to go pay the monthly premium for the Medicare supplement each time. And that's the way the market was. In recent years, the Medicare Advantage market has now migrated largely to a ton of very, very good PPO plans. Those PPO plans, while they're not identical to a Medicare supplement, are still going to be the best PPO you ever had prior to being on Medicare. Okay. So, Medicare Advantage PPO plans, no monthly premium, no referrals because it's a PPO. We only look at the ones that your doctors are mostly or ideally all in network with. They have zero deductible virtually always and very modest fixed dollar copays to get to your doctor. If you looked at the summary of benefits on a Medicare Advantage PPO and lined it up next to any PPO you were on prior to being on Medicare, you would just see this is just a way better version of anything I ever had. Okay. So I bring that up because, there's stuff that there's people read half articles and I get it. I do that as well. But the difference is not as polarizing as it once was. Okay. And I bring that up because with inflation affecting all of us, and prices going up, even in the Medicare space, one of several strategies is if you're on a Medicare supplement plan, is to possibly take a Medicare Advantage PPO plan for a test drive. So the benefits are terrific. There's no monthly premium. So you may have an opportunity to take a break from paying those monthly premiums, take a Medicare Advantage PPO plan for a test drive, see if you like it. And if you'd never been on a Medicare Advantage plan, you could do a round trip. You can go Medicare Advantage PPO in 2025, try it out. You might stay there. And if you're not going to stay there, you're guaranteed to come back to a Medicare supplement. So you get a one-time, one-year round trip. So I just want to bring that up. This is not a hero and villain type of thing. Additionally, most of the news you're going to see with Medicare Advantage is, certain networks take them, certain networks don't. By and large, like we live here in San Diego County, Scripps Clinic is out of network with all Medicare Advantage plans. But many of you, we have you on a Medicare Advantage plan that you still go to Scripps because you can still go to Scripps out of network. You just pay a little bit of a higher copay. Okay. So there's ways to navigate a bunch of different things. And I just want to lay out probably the biggest news with Medicare Advantage is whether they renewed their contract with your medical group. Usually there's not a lot of changes in that area. Lately, just a little bit more. I'll have clients reach out and say, hey, I just got this letter from my medical group. They may or may not renew the contract with the Aetna Medicare Advantage plan. If they don't, my medical group will be out of network starting January 1. And then, this stuff usually lines up with open enrollment. And we just know we need to move you to a Medicare Advantage plan that your medical group will remain in network. Okay. So it's definitely navigable. Anyway, so we stay agnostic. We just lay out the trade-offs. Once you understand the trade-offs, whatever's best for you is what you should do. I just like to point out that, you guys haven't heard from me in a year. So you read a couple of articles and, we're on top of it. When we're worried, we reach out to you, and we're concerned, we reach out to you. That doesn't mean don't bring up questions, but just send the Medicare, especially with Medicare Advantage PPO and Medicare Supplement, both terrific versions of PPO coverage. So anyway, that's that. Okay, so prices are going up and benefits are going down in some measurement, almost in every area of the market. Okay, so let's talk about what's causing that on a per product basis. and what we can do, if anything, to maybe combat rising costs or diminishing benefits. We'll also touch on dental insurance. Everybody's always wants to know, should I buy dental? Should I not? And I'll give you my take on that. When we've also introduced some other opportunities to mitigate risk within the health related portion of your portfolio. So we did put out a survey asking if people were interested in hearing about cancer indemnity policies, heart attack and stroke policies that basically provide you liquidity when you get medical events. A lot of the costs of a major medical event are not related to your Medicare Advantage or Medicare Supplement plan. So a lot of, caregiving, taking care of pets, transportation. We've had people fly across the country to Mayo Clinic. There's just a lot of disruption. And, some of you have the liquidity for that disruption. Others among you might not be able to exercise all the flexibility within your Medicare Supplement or Medicare Advantage plan because of liquidity needs and who's going to care for you outside the house and things like that. So we'll get an opportunity to chat about that. And along those lines, I'm going to give an abbreviated version here, but one of the topics that often comes up when you're engaging us about Medicare, and again, almost all of you come by way of your full service financial advisor. We have a great partnership with your advisor because we basically do the one thing in the financial plan that they don't do and wouldn't if they could, for reasons you already understand, Medicare, right? One of the topics that comes up most often around the Medicare discussion is long-term care planning. And I'm going to go as far to say that if you're 55 or older, single or as a couple, you're only on this earth because of 2 80-year-olds per spouse, 4 80-year-olds per couple. And you just need to have had a front row seat to one of those 2 or 4 80-year-olds to have gotten sick, gotten better, gotten sick, didn't get better, or they need care now and you get it. Long-term care is definitely worth planning for. We always suggest you start that conversation with your financial advisor. What I will share with you is that the later you inquire about long-term care planning, the fewer options and the more expensive that the options are. It doesn't mean you shouldn't start with your financial advisor, have that conversation with them. But if you're among the people who are concerned about long-term care, which is pretty much becomes everybody after 55, and we don't meet you till 65. There's this huge pool of people who are concerned about long-term care and a much smaller amount of people who bought long-term care insurance 10 or 15 years ago when it was less expensive because they were younger and the market was less expensive. Well, you got everybody concerned over here and only a small amount of people over here who have the insurance. Well, over here, we have some of you are higher net worth people, good savers who may not like it, but have the liquidity to self-fund or self-insure your long-term care event. Right next to you in that pool are a lot of you that are what we call reluctant self-insurers. You're self-insuring, but it's not because it was an active strategy. It's probably because you looked into long-term care. There weren't a lot of options. Maybe at 65, you're realizing 55 probably would have been a better time to do it. And you're just kind of hoping that your portfolio doesn't get really overly impacted negatively through a long-term care event. For those pool of people in certain states, so I don't want you to get too excited if this is exactly what you're waiting to hear about today, but there are some short-term home care insurance policies that sit right in the middle, kind of like Goldilocks' porridge. And I will say, having had a long-term care product distribution background, for what you get for these policies, they're priced very, very well. Not as robust as a long-term care policy, but way less expensive, very impactful positively towards your long-term care needs in the first 6 months. And and they cover you for home care, which is where everybody wants to start their long-term care event, and they're easy to qualify for, way easier than long-term care policies. So we'll do a little bit of a deep, not so deep dive on that, but I just want to let you know it exists. And if you're interested, you'll bring it to our attention. Okay, so here we go. Let's talk about Medicare Supplement first, okay? So Medicare Supplement, for those of you with a Medicare Supplement plan, you also have a Part D drug plan sitting next to them, okay? So where's the inflation monster kind of attacking there? Number one, keep in mind your Medicare Supplement plan. A lot of you are on Blue Shield of California or Anthem Blue Cross, United Healthcare, Mutual of Omaha, Humana, what have you. Those typically go up every year two different ways. Number one, you have a birthday. In most states, the monthly premium creeps up. God willing, you have plenty of birthdays and your monthly premium creeps up a little bit. Number two, just like car insurance or homeowners insurance or any insurance, every year, your Medicare supplement insurer, they're not going to pick you out of a lineup, but they're going to run up to or down or left or right to their state capital, to the insurance commissioner, and cry poverty and say, woe is me, we're paying out too much in claims. We'd like permission to increase everybody's monthly premiums another $7 or $8 or $9 a month. And the state insurance commissioner will say yes or no, or yes, but you can only have a $5 increase. So two ways that most of your Medicare supplement plans are creeping up every year. That's standard. That's the way it goes. Many of you have reached out to me because you noticed a very disparate increase in your Medicare supplement premiums this year. Why is that happening? It's kind of a COVID backlog thing, is the way it's been explained to me. So as you can imagine, any non-life-threatening or non-mission critical surgeries were not done during COVID. And now surgery centers are like packed to the gills because everybody's getting these surgeries now. So the utilization of Medicare benefits, both original Medicare and the supplement, have gone through the roof. And as a result, just like in California, when there's a lot of wildfires, or Florida, where there's a lot of floods, there's a lot of claims. And as a result, the insurance companies say, hey, we need to increase the premiums. So that is what's happening. Some insurers more than others, okay, but creates really a need for us to just put some fresh eyeballs on your Medicare supplement, see if you're still priced right. One of the strategies is, if you're on Plan G, we can look and see what another Plan G is. And most of the time, we just have to answer some relatively simple health questions to move you from one Plan G to another. And, if we can do it, then we should do it. We should always harvest some savings if it's easy to do and it's measurable enough to be worth your time. Another strategy with Medicare Supplement is to go from G to N. Most of you are on Plan G. Quick recap. You have a $240 annual deductible. If you're on Medicare Supplement, you already know you can go see any doctor in the country. No referrals, no networks. You have a $240 annual deductible. So your first $240 bill that you incur every year, you pay for, and then you do not see a medical bill for the rest of the year. That's Plan G. Well, your Plan G is getting more expensive. What could you do? One step below Plan G is Plan N. So if G is great, Plan N is nice. What happens with Plan Nice? Well, you still have a $240 deductible. Now you're going to pay $20 every time you go to the doctor. Well, it's not uncommon that you could save, let's say, $3 or $4 or, $500 a year, possibly, by going from Plan G to Plan N. So you just saved, let's say, $400 a year. You still have your $240 annual deductible you have to pay, just like Plan G, but now you have to pay $20 every time you go to the doctor. Well, if you typically go to the doctor 5 times a year, 5 times 20 is $100. So you saved $400 in premiums, and you gave back 100 of it because you went to the doctor 5 times. You're still ahead $300 a year, $600 a year as a couple, right? So there could be some meat on the bone to warrant attempting a move from G to N. Doesn't change the fact that you can go to any doctor in the country, Mayo Clinic, Cleveland Clinic. So those are some of the Medicare supplement strategies, not the only. Your Part D drug plan. Okay, this is where there's a lot of disruption. So the Inflation Reduction Act is being fully phased in, or almost fully phased in, January 1, 2025. Just like any legislation, there will be winners, there will be losers. The broad-based claims of the Inflation Reduction Act are that they're going to reduce drug costs for people on Medicare. Sounds nice. Is it true? It is for some, it's not for others. There's never been an out-of-pocket maximum on Medicare Part D before, which sounds scary. In reality, the biggest Part D out-of-pocket copays I've seen have typically been around cancer, okay, which might be one more reason to consider a cancer policy to go along your Medicare supplement. But cancer meds, historically, if you were a client of ours and you're dealing with cancer, you were probably paying $7,000 to $8,000 a year. I've got one client who pays way more than that. He knows who he is, and he's going to be patient zero of who benefits from the Inflation Reduction Act. And I'm actually very excited for him because it's nice to see the legislation benefiting people. Anyway, there's now going to be a $2,000 max out of pocket. So the biggest check you can write if you're on Medicare for your Part D drugs is $2,000. $2,000 is way less than $8,000, right? Question is, how many people are paying more than $2,000 a year? There's about 63 million people in the country on Medicare, and I think about 4 million people typically pay over $2,000 a year for their meds. So those people will clearly benefit from the legislation. Now, what's happening is the messaging on the legislation is, hey, we're going to stick it to the insurance companies and the manufacturers and make them pay their fair share. That's not really what happens in a lot of cases. So one of the other things to keep in mind is that when Medicare, when your meds get really expensive, you go into what's called the catastrophic phase of Medicare Part D. Your meds are really expensive, translating that to English. Well, the way this used to work is once you got into the catastrophic stage of Medicare Part D, Medicare used to pay 80% of the retail cost of those very expensive meds. Now they're going to pay 20%. So the legislation says, hey, you can't charge the end user, you, more than $2,000 at the pharmacy counter at CVS. In addition, when this stuff gets really expensive, we, Medicare, used to pay 80% of the bill. Now we're going to pay 20% of the bill. Okay, somebody has to pay for these meds. Will the manufacturers take a hit? A bit. Everybody I know in the industry just said it's actually pretty neutral. Maybe they pay something. The insurance companies, they'll pay a little bit, but the math still has to work. So ultimately what's going to happen, what is happening, by the time you're reading this, you probably have already gotten notice, is that the insurance companies are increasing the monthly premiums on your Part D drug plans probably 50 to 100%. So a $30 plan could easily be $60 a month next month. I even had somebody reach out that their $25 plan is going to $120 a month. Clearly, that person probably needs to change plans. We live in California, and every time there's a new gas tax, the gas companies don't pay that. The gas stations don't pay that. They just pass. If it affects everybody, it gets passed on to the consumer. So that's what's going to happen with the Inflation Reduction Act. There will be people who benefit. I don't want to. I don't want to disparage the legislation totally, but it's like you squeeze a balloon in one area, it's going to pop out somewhere else. So a smaller amount of people are going to benefit, and those people are on really expensive meds and they were paying quite a bit, so they will benefit in the major way, and pretty much everybody else is going to pay for it. That's just the way legislation works. I'm not opining on anything. I'm just kind of sharing that. So every September, you get your annual notice of change A lot of you have already started reading them. And basically what they do is they lay out, hey, here is your Part D drug plan in 2024. This is what it will do and won't do at what cost in 2025 if you keep it. Nobody would hurt my feelings if they tell me they usually don't read their annual notice of change, but it is a pretty clear document. I mean, coming from a government mandated effort, they kind of put in bold what the differences are. This year, you need to read your annual notice of change, okay? Because we're trying to reach out to everybody who's affected, but if you had a $30 plan that went to 90 and you don't realize it till January 1st, it's too late, okay? Now, what's the exception? Because I know there's a couple of you, a lot of you listening, and you go, that didn't happen to my drug plan. Wellcare has the top Part D drug plan in the country. It's called the Wellcare Value Script, and we've used it with a lot of you. The average sustainable monthly premium on a Part D drug plan is about $30 a month. Anything under 30 is the marketing department throwing money at it to kind of keep it artificially low. And it usually jumps up and moves around. Wellcare has, they went from $13 to $8 to 50 cents. And it's actually, while everybody else is going up, they're going down. I don't know that it's sustainable, but they're not increasing prices in 2025. Okay. So if you're on the Wellcare Value Script and you're on a no meds, you still should stay on the Wellcare Value Script. Okay. If you're on a couple of meds and they're all generics, I'm not suggesting that you move from the Wellcare Value Script. Matter of fact, if you're even on a couple of meds with some brand name meds, I'm expecting in a lot of cases that the Wellcare Value Script is going to be the plan you should stay on. Additionally, this is our problem, not yours, but Wellcare made an unprecedented decision in the industry to stop paying insurance agents, not just us, any insurance agents, on Wellcare Value Script business that we have already written. Okay. So what's not uncommon is that they say, hey, we're going to keep this drug plan on the market, but we're not going to pay broker commission. So a lot of brokers wind up moving on to something that's priced competitively that does pay a commission. Okay. That's just economics. So that happens, and we see that all the time. And sometimes we still suggest you go on those plans. What's unprecedented is that they're finding a way to stop paying us on business that we've already written and serviced and things like that. That's our problem, not yours. Look, if there was a viable Part D drug plan that makes sense for you to move to, we'll bring it to your attention. I'm anticipating a lot of you. I'm just going to tell you to stay on the Wellcare Value Script plan because for you as the end user, I expect it to still be priced very, very well for people on no meds, just a few meds, even a couple different meds. Okay. But one of the things we'll do is we'll post a video. So if that's your biggest concern this year, and we've already taken a look at your pricing on your Medicare supplement and we cannot improve on it, we'll post a video of how you can review your own drug plan on Medicare.gov if you don't want to wait 3 or 4 weeks to talk to us, because during busy season, it just kind of takes a while. So I think Wellcare Value Script, most of you will probably be fine just staying on it. The more meds you're on, the more necessary it is to review your Part D drug plan with us or on your own. Okay. All right. So you could be in a situation where your Medicare supplement plan is going up precipitously because of the COVID backlog, and your Part D drug plan is going up. Okay. And everything else in your life is going up. What else could you do to combat inflation? You could go from 1G to a better price G, or G to N, right? Or reprice the drug plan. Additionally, like I said, if you've never been on a Medicare Advantage plan, normally one of the reasons you chose a Medicare supplement, among others, was you had a one-time guaranteed acceptance into the supplement. And we tell you every time, hey, if you start with Medicare Advantage, you want to go to Medicare supplement later, we're going to have to answer health questions. And, a lot of people go, I don't want to mess with the health questions. I want my Medicare supplement. So you've got that. That's one of several different reasons you have it. But if you're just getting squeezed on inflation from every which way, and now knowing that a Medicare Advantage PPO plan is still a really good PPO plan, if you've never been on a Medicare Advantage plan, there is something called a Medicare Advantage trial right, which means you're on a supplement. You've always been on a supplement. You've never been on Medicare Advantage. We could take a look and see what Medicare Advantage PPO plans that your doctors are in network with, and we could test drive a Medicare Advantage plan, PPO plan in 2025, no monthly premium, no deductible, very modest copays, probably some extra benefits, maybe some dental and vision wrapped in there. And you can test drive that thing for 1 year, so 2025. And then this time next year, we meet again and you say, hey, I think I'm going to keep it. Or you say, you know what? I liked it, because you probably will, but I just want, financially things are better, or I just don't want to give up my Medicare supplement. And then we can do a guaranteed re-entry into your supplement. So it's an opportunity to take a 1 year break from paying those rising monthly premiums on your Medicare supplement, just to get your cash flow back under you. And like I said, it's not good versus evil. So you're going to go from one policy that's the best coverage you've ever had to the other one that's the best coverage you've ever had, and take it for a test drive. So Medicare supplement, never been on a Medicare Advantage plan, you get a one-time 1 year round trip test drive the Medicare Advantage plan for a year. This time next year, we decide whether we keep it or we're coming right back to your supplement, guaranteed, no health questions necessary to be answered. Okay, so that's probably the biggest inflation hedge that we can offer to you. And we've had several of you that have, fired that bullet in years past once gas got up to $6 a gallon and things like that. Okay, so, moving on to Medicare Advantage. This Inflation Reduction Act disruption is affecting Medicare Advantage as well. Now, Medicare Advantage covers everything. It takes over your Part A and B from the government, does the Part C, the Part D. It's all kind of wrapped in. But the cost of providing you that Part D drug coverage inside your Medicare Advantage plan has now gone up. Okay. And there's a bit more meat on the bone there for the Medicare Advantage plan to mitigate that. But what we're seeing is a lot of the extra benefits on your Medicare Advantage plans are getting scaled back. Your vision coverage might be getting worse. Your dental benefit might be getting worse. Maybe you had $55 a quarter that you could spend on over-the-counter pharmacy supplies. Maybe now that's going to be $25. Maybe it's going to be zero. Okay, it's because of the Inflation Reduction Act and just phasing this in. So if you look at your annual notice of change and you don't like what you see, which we wouldn't be offended if you didn't, probably worth an annual review. We'll go through it. We will empathize, we promise, right? But we might tell you there's a plan that your doctors are in network with that we can move you to. We might tell you to just have to be grateful for what you have. Okay. But we're happy to go through that exercise and help you understand that. Okay. So if you see something you don't like about your Medicare Advantage plan, your annual notice of change, probably worth, we just review it. And, we'll give you the good, the bad, and the ugly. Okay. But I don't think the zero premiums are going to start going to $5 or $10. Everybody loves zero premiums, but those extra benefits are the first things that are being scaled back. Additionally, Medicare Advantage or a standalone Part D, the formularies are shrinking. So the amount of meds that they cover is less because of the Inflation Reduction Act. It's just the insurance company trying to make the math work. Additionally, you're going to see some formulary reductions, like if you have two brand name meds, no generic, and they're just direct competitors. They both do basically the same exact thing. One is less expensive, one is more expensive. The less expensive one is going to get kicked off the formulary. Okay. Because the insurance company says, well, if we're earning 23% margins on these meds and the math is now tougher to make work because of this new legislation, do we want to earn 20% on a big copay or on an expensive med, or 23% on less expensive meds? So you're going to see some formulary shrinkage as well. I'm hoping it does not affect Um, prior authorizations, those usually go through pretty seamlessly. Um, I have concerns about insurance companies being more stingy on prior authorizations. I don't know if that concern is founded yet, but that's what I'm thinking about. Backing up. Medicare Supplement. One of the other ways to improve your Plan G pricing is pretty much every Medicare Supplement Plan G has a gym membership built into it. So it's just built into the pricing. Humana has a Plan G that is in a lot of major metropolitan areas considerably cheaper. It's identical. Um, it pays identical to any other Plan G. It just doesn't have a gym membership. So because they don't have to provide that gym membership, it's cheaper. So if you have a Medicare supplement and you're not going to the gym and you don't think you're going to go to the gym, we might be able to strip that out of your Medicare supplement to reduce your prices. The other thing, sorry, going backwards quickly, on Medicare supplement, when we call you up and tell you there's an opportunity to improve your Medicare supplement pricing, these things pay identically. A Plan G is a Plan G is a Plan G. If there's an opportunity to improve the pricing, you should take it. You know, some people go, "Oh, I really like my United Healthcare." I mean, it's like saying I like a gallon of gas at Chevron versus Shell. You know, when we put you on this, Chevron was cheaper. Now Shell is cheaper. And without making this about us, we also have incentives to make sure your pricing is good because we want to keep you as clients. Additionally, the revenue on these Medicare supplement plans kind of drops off at about the 5 or 6 year mark, which is about as much time as it takes for a pricing disparity to happen. We're not going to get paid on a lot of your drug plans. And, you know, if you have a Medicare supplement plan that, look, if it's the best thing for you and keep it, you know, that's totally fine. But, you know, we need to be able to do our jobs and kind of cultivate your Medicare supplements and make sure that you're priced right. And just know that there's no difference in how a Humana Plan G pays claims versus United Healthcare, Anthem, Blue Shield. These things are brainless, mindless, indentured servants to Medicare. So the reason you're on the plan that you're on is because when we put you on Medicare, that was what was priced best among the major companies that price well, that tend to have pretty stable rate increases, don't make us look foolish, and honestly have not ticked off me or Alex or Hanzel or any of you recently. So sometimes we put insurance companies in the penalty box. Okay. So moving on from Medicare supplement, Medicare Advantage, you know, we covered that. If you see something you don't like in your annual notice of change, or your medical group did not renew their contract with the Medicare Advantage company, we need to talk. Okay. All right. So those are the overarching strategies, the big Medicare stuff that I want everybody to know. All right. Now, dental insurance. Everybody goes mental for dental. Okay. So what do we think of dental insurance? When I first started off, I told every one of you not to buy dental insurance, and I was very flattered because 100% of you listened to me. It was very flattering. But what I noticed is, you know, the biggest dental bills you'll have in your life typically happen after age 65, and not everybody is as comfortable self-insuring as I thought that they were. So here's the litmus test on dental insurance. You just want dental PPOs. That's not a surprise to anybody listening to this. We want to find the PPO plans that your dentist is in network with, which I'm sure logically makes sense. Let me quantify that for you. My next door neighbor is a dentist here in North County, San Diego, Scott Holyoak, HolyoakDental.com. And he's a great guy. And I'm always poking my face over his fence like Wilson from Home Improvement, asking him questions about dental claims. So here is the way Scott explained dental insurance to me. He said, Brian, if I'm in network, it usually means I've agreed to contracted rates about 40% less than I normally charge. Okay. And that he gets all day long. So he said, so if a Crown If I normally get $1,500 for a crown, if I'm in network, I have probably agreed to do that crown for $900. And typical insurance on a crown would pay 50% of that number. So he normally gets 1,500. The contracted rate is 900. Insurance pays 450. Patient pays 450. Dr. Holyoak would say, I have $900 in my hand, and I'm not allowed to ask you for any more money because I've agreed to the contracted rate because I'm in network. Okay. So that's the in-network transaction. The out-of-network transaction is you need a crown. He gets $1,500. Your dental insurance still pays $450 on the crown. They don't care if the dentist is in network or out of network, but he has not agreed to contracted rates. So he says, I get $1,500 for a crown. Your insurance paid $450. You owe me $1,050. Now, maybe he knocks off $100, maybe $200. Probably not more than that. So that's the out-of-network transaction. So clearly, the biggest benefit I feel of dental insurance is making sure you match it up where you have a dental plan that your dentist is in network with. So how do we do that? Well, we chase down the plans that your dentist is in network with. Simple enough. If you're not terribly loyal to your dentist, then we can chase down the plans that are pricing best benefits, lowest prices, and just say, hey, just use a dentist that's in this network. That's another option. Some of you are very loyal to your dentist, which is totally fine. Some of your dentists are out of network everywhere. Okay, so that dentist is probably 60 years old or older. They have a mature practice. They're not hurting for patients. And they say, I still have to price competitively to other dentists, but I'm not working for 40 or 50% less anymore. Okay. If your dentist is one of those, and some of you have that, I would save your money. I wouldn't buy dental insurance because the out-of-network transaction, I just don't think the premiums you pay are worth the claims that you're going to get back. So in-network is where the key is. If we can match you up with plans that your dentist who you're loyal to is in network with, then there's some great dental benefits. If you're not loyal to your dentist, then we just show you the plans that are pricing best that have not ticked us off lately. And we just help you find a dentist who's in network. Okay, so that's my thought on dental. Cancer, heart attack, stroke, hospital indemnity. So there are major health events are very disruptive. And like I said, if you have a Medicare Advantage plan and you do wind up in the hospital dealing with cancer, you're going to get some bills. Okay. It's not awful, but it's going to be four-figure type bills. So you can buy, a cancer or hospital indemnity policy that will pay you, maybe your Medicare Advantage plan, if you had cancer, you paid $5,000 to hit your max out of pocket. Okay. So it'd be nice to have a benefit that pays you $5,000. We're usually building these to say, hey, let's do this for 20,000 or 15 or 25,000, just because, if you have a major health event like that, it's going to be disruptive more in your personal life, and you're not going to want to be negotiating. You just kind of want to hire people to clean your house, hire people to walk your dogs, get the transportation you need. Also, I mean, there's other things like that, like, there's policies that pay because you have cancer. There's policies that pay because you had a hospital stay. There's policies that pay because you had a stroke. You can kind of combine them to kind of make sure you're getting paid something when something happens to you. There's other things like Medicare Supplement. As great as it is, they do not cover medical transportation. So we've had people on a Medicare Supplement plan, which is, you pay for it, but you basically never see a bill like on Plan G. But we've had people that have like they're bedridden, but they still have to go to the doctor sometimes. And a Medicare supplement does not pay for routine ambulatory transportation. So no matter what a lot of these policies do is they're triggered to drop, $10, $15, $20,000 in your lap upon a major medical event. If those are things that you're concerned about, let us know. Okay, so moving closer to the end here, let's talk a little bit about long-term care. I touched on it a moment ago. Again, if you're one of those reluctant self-insurers, so you kind of wish that you had bought long-term care insurance by the time it became obvious to you that would have been a good idea. You're older, which means there's fewer options, and the options that are there are more limited. Let me quantify that because I don't want to sound like I'm, uh, fear mongering or anything like that. But a traditional long-term care policy, if you're 65 and you're looking at something meaningful that's going to cover you, maybe four or five, $6,000 a month for 4 or 5 years. At age 65, you're looking at, five, six, $7,000 a year in premiums. Okay. You're not going to buy it. Okay. Nobody buys it when they look at traditional long-term care that late in life. The alternative to that are hybrid long-term care policies that some of you own. Because when I have this conversation with you, you tell me, oh, my financial advisor set me up with Lincoln Money Guard. It's it's the staple for higher net worth people. That's usually what they do. So if you have that, you probably don't need to pay attention to this part as much. But, if you try buying that at 65 or 66 or 67, the leverage you get, you have to you might put in $100,000 sitting into a policy. Maybe it'll pay 250,000 in long-term care benefits, where had you bought it 10 years ago, that 100,000 would have leveraged up to 500,000 in long-term care benefits, right? So that same pool of money buys you less leverage. Or if you have your height set on, I need a $500,000 pool of long-term care funds, you're going to have to allocate way more than the $100,000 you would have had to allocate, years ago. So I would still encourage you to have a conversation with your financial advisor. But if you find that the options are limited or they're expensive, or you just can't allocate the reason, you don't have enough in your portfolio to do that, or you had a conversation about long-term care with your financial advisor, but you have some health issues that they just said, you know what, nobody's going to approve you. And most people have an idea of what that is. Then here's an option in certain states that I think is a great option. So let me start off and just point out the states here. Okay, so the easiest way to explain this is one, not in California. Okay, so it's not in California, not in Florida. If your state touches Canada, it's basically not available. Okay, we've got like one client in Montana, so Montana can have it. New England and the tri-state area, not available. And then basically not available in Kentucky, Kansas, New Mexico, and Utah. Okay. But if you're in any of these other states, I'm going to go as far to say that if you don't have a long-term care policy, you should absolutely consider a short-term home care policy. So here's what I mean by this. Okay. It's not as robust as a long-term care policy, which is why it's cheaper, but it covers you very abundantly in the first 6 months, and it doesn't cost you a whole lot. What do I mean by that? This policy gives you $150 a day for home health aid care. Okay. So not necessarily a medical event. It's your primary care doctor signing off. This is the triggering of these claims is identical to a long-term care policy. Is somebody with MD at the end of their name, your doctor, is willing to sign off to say that you cannot perform 2 out of 6 activities of daily living. Can you feed yourself, bathe yourself, dress yourself, transfer yourself out of a bed and into a chair, out of a chair into a bed? Can you make an unassisted trip to the little boys or little girls' room, or do you have continence issues? Any 2 out of those 6 that a doctor says you cannot do, you qualify for care. Or you have a severe cognitive impairment documented by your doctor. That's identical, the identical path to collecting money from the insurance company on a long-term care policy versus this. What does it do? You get $150 a day for home health aid. So it doesn't have to be medical. Okay. Just helping you with those activities of daily living. That could be $4,500 a month. Okay. Of home care benefit, payable immediately as soon as your doctor signs off on it. You just keep getting reimbursed for every day of care. All right. So $4,500 a month for up to 6 months. Okay. It's really $150 a day for 180 days. So if you just got care 5 days a week, because you had loved ones caring for you on a weekend, you would stretch that 180 days way further into the calendar year. Okay. So I got to tell you, if the ship has sailed on long-term care, $150 a day for home care, 180 days, and you're going to want to have home care. For most of you, this is under $100 a month. Okay. And it actually does a couple other things that I haven't even mentioned. If you're receiving nursing home care at home, it pays you $300 a day for every day you receive care. If you're hospitalized, you get $300 a day for every day in the hospital for up to 6 days. So that's all wrapped into this. But the big reason I'm bringing it to the attention of clients is those reluctant self-insurers who don't have anything. Here's something, doesn't cost a whole lot. And it's pretty meaningful for what they charge you versus what you get. Two other things on this is it actually costs less than that. Because let's just say it's $90 a month. They also reimburse you on your prescription refills. So let's just say you're taking 4 generics. Even if you pay $0 at the pharmacy, every time you fill your generic every month, you get a $15 reimbursement. So $15 times 4 generics, you got $60 reimbursed to you every month. So let's say you paid $90 a month, which is already a good deal for 180 days of home health aid coverage. But you're paying $90 a month, you're going to get $60 a month back. So you're really paying $30 a month. There's no reason not to do this if I've described you. Okay. Final thing, what does it take to qualify? This is like the best part because, again, some portion of you were interested in long-term care and the financial advisor said, hey, they're not going to approve you. We shouldn't even try. All you have to do on this is answer no to 4 questions. This is it. Are you currently receiving assistance or supervision to perform your activities of daily living, such as bathing, dressing, eating, toileting, getting in or out of bed, or having an ability to control a bladder or bowel function? Are you currently receiving home health care services or confined to a rehabilitation facility? Within the past 12 months, have you been diagnosed or being prescribed medication for Alzheimer's? And finally, in the next 60 days, do you expect to be admitted to a hospital, nursing home, assisted living facility, or require home health care services or have surgery? Those are the only questions. If you can answer no to those 4, there's no, long-term care insurance is way more in detailed underwriting. So for people in the right states who don't have long-term care, especially if you're taking a couple of medications, no reason not to do that. Let us know. So that's those are the things I wanted to cover. Wrapping up, I will say that Hanzel has already started to reach out to those of you who we know we need to meet with this year. So please reply to Hansel's emails. We're trying to there's certain populations of people that we just need to get handled first, or at least who want to get handled first. A couple of you have had some medical groups leaving your Medicare Advantage plan. We want to get you taken care of immediately and not have you kind of worry about, whether you're going to be able to see your doctor. Some disruptions in the Part D space. Anybody who's maybe, told us they need to talk to us about other things. So when Hanzel reaches out to you, and there's a bigger list this year than there's ever been, please be responsive and get on the calendar. And Alex and Jen and I will just kind of help you out. We are so appreciative of all the trust you put in us. Everything we do is designed to make sure we get you a good result over a long period of time and make sure that any interaction you have with us, regardless of the outcome, reflects well on your full service financial advisor. So thank you for your referrals. You're going to have other friends and family that are in the same boat. $30 drug plans going up to $75, or the Medicare Advantage plan got worse. We're always so appreciative when you're kind enough to introduce us to friends and family. So I'm doing all the talking. I'm not doing any of the listening. I always try to keep this short. I think I probably failed, but we don't usually barrage you with a lot of email communication throughout the year. It's really important that we get you to listen to this one before, just so that you know whether we need to speak. Okay. Anyway, anything to add, Alex?
I thought that was definitely a great recap of all the important things that we're going to need to do. And I've been speaking with a lot of you already and trying to optimize the plans, and we're definitely getting some ideas, and we know what we're going to expect coming in October. The I want to meet with you. I want to talk to you. I want to see what changes that we're expecting, and of course, we'll let you know if there's ways that we can just like Brian said, we want to try to find a plan that's going to be good and stable for the time, for a very long time to come. And if we have to change it, then we're going to do exactly the same. We'll change it and try to find another one that's going to be as stable for as possible. So I'm excited to get started, and I know we're going to speaking with a lot of people this year.
Yeah, no, definitely. This will be the biggest year. So anyway, thank you to everyone. Please stay safe. God bless. We're looking forward to catching up with you this fall. And if we don't need to catch up with you, then no news is good news. We'll be grateful for that, but it probably means we'll catch up the year after that. If you need us, definitely reach out. We're definitely here. I just want to give people the opportunity to know that it doesn't have to be urgent if we don't see any reason, any urgency on our side. So everybody have a great day, and we'll talk to a lot of you in the fall.